Hello and welcome to Pregnancy Info. Being pregnant is one of the biggest joys in the world. If you are pregnant for the first time, you will wonder how your body will change and what all symptoms will you experience. What will you experience in the early stages of pregnancy? In the first month of pregnancy, you may experience certain signs and symptoms, though these may appear more like premenstrual symptoms and may confuse you. But you must know that these common symptoms are: Number 1. No periods. Missed periods is one of the major indications of pregnancy. As soon as a woman conceives, her body stops releasing progesterone hormones. These hormones are responsible for stopping the periods also. Missing periods is one of the first signs of pregnancy. Slight spotting. When the egg attaches itself to the uterus in the process of fertilization, some amount of cramping and spotting may be experienced mostly. It may be noticed while washing or wiping your genitals, though most cases of the first pregnancy, bleeding or spotting are considered normal. If you notice any abnormal amount of blood or spotting, then you should seek immediate help. Breast tenderness. Your breast may feel sore or tender to touch. This symptom is quite similar to premenstrual symptoms. Your mood swings. Due to the major hormonal changes happening in your body, you may feel your moods to change quickly. One moment you may feel happy, and in the very next moment you may invoke the feeling of despair. You may find yourself snap for no reason. These are all very normal symptoms of pregnancy. Frequent lewd trips. Hormonal changes will be rapid in the first month of pregnancy, and as a result there will be more blood flow around the pelvic region. This aids in thickening the uterine lining for optimal fetal growth and development. To handle the increased body fluids, the kidneys are required to work more. Hormonal changes and the changes in the kidneys plus the growing uterus may put pressure on the bladder, which may lead to increased urination. Tiredness. In the initial months of pregnancy, you may feel tired and low on energy more than usual. The feeling of being tired or exhausted may lead to sleeplessness too. Change in food habits. You may develop a liking towards certain food items and you may despise some food items. It is very normal for you to have an aversion to your favorite food and you may crave the ones which you disliked. Morning sickness. Most pregnant women may experience nausea or vomiting in the initial stages of pregnancy. This can be experienced within 3 weeks after conception. Some women may feel nauseous all through the day, whereas others may feel this around a particular time of the day. Heartburn is very common during pregnancy. The various changes happening inside the body are responsible for acid reflux and heartburn at the onset of the pregnancy. Heartburn is also very common in the later stages of pregnancy when the growing baby pushes the stomach itself and stomach's acid make its way back to the esophagus. Heightened sense of smell. Many women experience heightened sense of smell in pregnancy. You may like certain smells and may not be able to stand the other few. Irregular bowels. The increased level of progesterone in the body make changes in the way various muscles function. This changed hormonal level makes the muscles to work slowly, and thus the food may pass slowly through the intestine, leading to irregular bowel movement or constipation. Giddiness or dizziness. The presence of progesterone may cause blood pressure to become low and make you feel giddy or dizzy. Back pain. The ligaments covering the pelvic region loosen up during pregnancy as a result of increased level of progesterone in the body. These loosened ligaments in your rear may cause back pain. Hunger pangs. Diet plays an important role in pregnancy. You may and your body may also guide you towards the same. You may find yourself hungrier than usual and may crave for food more than often. Headaches are the beginning of your pregnancy journey. A lot will change inside the body. The increased hormones, blood volume, and stress may cause random headache. These are the initial symptoms that you may experience in the beginning of your first trimester. Along with these symptoms, you may notice changes in your body too. Changes in the body during the initial months of pregnancy. You may not notice any evident physical changes changes, you may see the following changes in your body. Your breast size may increase due to hormonal changes in the breast tissue. You may feel bloated and your clothes may feel little tight around the waist. Your nipples or aerola may turn bigger and darker. You may experience increased vaginal discharge. You may experience occasional spotting. And now we will discuss about the development of your baby in the first month. When you become pregnant, this is how your baby will develop in the first month. The process of fertilization. The process of fertilization may happen anytime within 48 to 72 hours after sexual intercourse. Your baby comes into existence as soon as ovum and spermatozoa unite with each other. At the stage your baby can aptly be called as a zygote. The zygote multiplies very fast, and this is how your unborn baby grows and development starts. The process of implantation. The zygote thus formed starts to travel through the fallopian tubes towards the uterus. The zygote then divides into morula, a solid cluster of cells, by around the fourth day. In the next few days, the morula divides into the blastocyst and tries to attach itself to the uterine wall of nutrition. As it implants itself, the embryos get surrounded by the yolk sac and blood vessels to obtain nutrition until the placenta is formed. The process of development. Around the third of the fourth week, your baby's heart will start beating. Though your baby will be just the size of a pea, the arm, legs, and lungs will becomes. The baby's face will start forming too, which will include ears, eyes, mouth, and nose. Diagnosis and tests involved in the first month of pregnancy. You must visit a gynecologist the moment you suspect that you are pregnant. Your doctor may suggest the following diagnosis and tests to establish your pregnancy. Number 1. Medical history and physical examination. You will be asked to share your last menstruational duration, flow, and frequency, and also the method of contraception, if you may used any, and then the physical examination to find out pregnancy. Then the test will be started. Your urine sample will be taken to establish the presence of HCG hormone. A blood test may be suggested in the case of results are not convincing. The HCG hormones are monitored closely to check if they are growing slowly or at a lower rate, which could indicate an ectopic pregnancy. The high level of HCG can mean chromosomal abnormality, molar pregnancy, or multiple gestations. To establish any kind of abnormality or risk in pregnancy, serum progesterone will be measured. Ultrasound scan. Ultrasound scan are very effective in establishing a pregnancy. The transvaginal ultrasonography is very beneficial in establishing intrauterine pregnancy. The vaginal scans are better than the normal abdominal scans because of higher frequency and better resolution of the image. Now we will discuss what to do. First month of pregnancy tips to take care of yourself. Once your doctor confirms that you are pregnant, then the following tips you may follow. Prenatal care. You may start with your prenatal care routine, which should include taking your vitamin supplements. Folic acid is the most important supplement that you may start taking as soon as you plan to get pregnant until the conception. Folic acid will help you have a healthy pregnancy and also lower your baby's risk of developing any neural tube defect. Prenatal appointment. You may start planning for your prenatal appointments with your doctors. You may choose and compare various options available and narrow down to the one best suited to your requirements. Choosing the right doctor whom you can trust is very important. You may also take references from family and friends for the same. Choosing a caregiver or a helping hand. You may also like to choose a caregiver carefully. Take recommendations from friends and family for the same. Refrain from self-medication. It is suggested that you do not take any over-the-counter medicine before consulting your doctor. When in doubt, consult your doctor to avoid any probable complications. To know what you should do. Number 1. Increase your fluid intake. It is very important to stay hydrated during pregnancy, as dehydration may lead to complications. The best way to stay hydrated is by increasing your daily water intake. You may put an alarm that reminds you to drink water. Alternatively, you may drink fruit juices, vegetable juices, or soup to your fluid intake. Eat more fibrous foods. The changing hormones may lead to constipation. Therefore, it is suggested that you include more fibrous food in your diet. Legumes, leafy vegetables, cereals, fruits are good ways of eating fibrous food. Exercise. It is important to exercise in order to stay healthy and fit. The same applies to pregnancy as well. You should do mild exercises to help your body function properly during pregnancy. Walking is the ideal way to exercise without causing any unnecessary exertion to the body. However, it is best to get in touch with your doctor before following any exercising routine. Get adequate sleep. Your body is undergoing a lot of changes in pregnancy, and this makes you very tired and exhausted. Therefore, it is very important to get ample rest and sleep when you are pregnant in order to regain your lost energy. Stay positive. Both your physical and mental health can impact your unborn child. Listening to good music, reading a good book, or any activity that makes you happy should be followed regularly. Maintain hygiene. With your hormonal levels taking a jolt in pregnancy, you may become more and more prone to vaginal infections such as vaginal candidiasis. Therefore, it is important to maintain good vaginal hygiene to keep any such infections at bay. What you should not do. Here are some things that you should refrain from doing in pregnancy. Drinking caffeinated beverage. Do not consume caffeinated beverage such as tea, coffee, or cola in pregnancy. The caffeine may cause insomnia, heartburn, and anxiety in mummies and it may also cause risks to your baby's health. You may have preterm labor or you may have low birth baby weight. Eating unhealthy food. Eating unhealthy or junk food can increase your chances of unhealthy weight gain and thus increase your risk of gestational diabetes and high blood pressure during pregnancy. Fried and oily food too can affect your immune system, and unhealthy foods are also not good for you or your baby. Thus, these are food items to avoid in the first month of pregnancy. Drinking alcohol. Mothers who consume alcohol during their first month of pregnancy are more likely to give birth to babies with birth defects. There is a higher risk of a baby having congenital birth defects at birth. Smoking. Smoking may cause severe health complications in your unborn baby. Mothers who smoke during pregnancy are at risk of delivering babies with low birth weight or breathing problems. Not only active smoking but passive smoking can also be fatal for your unborn baby's health. Wearing tight clothes. Your body will go through many physical changes in the pregnancy. In order to keep your body comfortable, you should wear loose clothes and help your body relax. Refrain from wearing tight-fitted clothes, especially around your abdominal area. Doing strenuous chores, bending or lifting heavy weights is strictly prohibited in pregnancy. Such activities may put unnecessary pressure on your abdominal region, which may harm your baby. Going on long journeys. The first month of pregnancy is very critical, and thus you should refrain from putting your body under any kind of stress. Long travels should be avoided in the first trimester. Taking sauna and hot baths. You should avoid taking sauna or hot water bath in your first month of pregnancy. Exposing your body to temperature that is more than your body's temperature can be fatal for your unborn baby. High temperature may affect fetal growth and development. Refrain from having sexual intercourse in the initial 2 months of pregnancy, or else follow safe method. Talk to your doctor about the same. Do not expose yourself to harsh chemicals. It is very important to keep your blood pressure and blood sugar levels in check. Therefore, you must eat right. Avoid coming in contact with the poop of pets such as cats, dogs, birds. Hope you have understand all about the changes and symptoms and do's and do nots about first month of pregnancy. If you find this video useful, then like it, share it, and also subscribe our channel. Thank you very much.